Hello dear patients, today we are going to discuss the case of mucus from penis. A young man came to us and he had his last sexual contact a relatively long time ago, about 3 months ago. It was an oral contact without vaginal and anal contacts. So recently he had been bothered by some burning in the canal and mucus that you can see on the picture. So here a smear test for inflammation or smear test for flora was taken. Culture test for bacteria was taken and analysis of sexually transmitted infections were taken in the form of smear from urethra and PCR analysis. So leukocytes were about 25 to 30 within a visual field. Culture test was negative, meaning that there is normal flora there and gonococcus was found in PCR analysis. Generally speaking, gonorrhea is not rare today, and today it is less subject to treatment by tablet additional medications. This is a separate story. The essence is that during such minimal manifestations, it's not clear whether the contact was 3 months ago or earlier. This young man has gonococcus. I often have people coming to me with quite severe discharges or just with some discharges and they think that this is gonorrhea. However, recently we don't find gonorrhea very often. Quite often it's chlamydia, mycoplasma, ureaplasma, gardnerella and other causative agents. What does this tell us about? This tells us that by discharges you cannot set a diagnosis, you cannot presume it. And of course you shouldn't treat discharges by some unknown tablets. Indeed, today we observe a tendency to diversity. For example, ureaplasma and gardnerella can even induce purulent discharges. Even ureaplasma parvum can do that, and I have quite a lot of such cases in my practice. At the same time, gonorrhea, as we see, induces relatively small mucus discharges and small leukocytosis. Therefore, never try setting a diagnosis to yourself just by discharges. For this you need analysis, at least the ones I mentioned, and the complex treatment is also required. This patient was treated for 10 days by injections together with tablets and instillations. You can watch a separate, more detailed video about treatment of gonorrhea on our channel. We are not going to cover it now. In 3 weeks' time, control analyses were taken, and there was no gonococcus or inflammation there. So, if you need diagnostics during some discharges, burning, itch in urethra, you can consult venerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of different sexually transmitted infections. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.